Hi, I'm Art Caplan at the Division of Medical Ethics at NYU School of Medicine. So when is it necessary to maintain privacy if you're a physician and someone tells you something, whether it's at a party, social event? Is it only when you're bound by a formal relationship, the doctor-patient relationship, where you and the patient have agreed to see one another and there's payment exchanged? Is that the limits of where privacy ends inside that relationship? I don't think so. Interestingly enough, Matt Lauer, the NBC Today host who fell from grace recently, accused of sexual harassment, it provides an example where this notion of privacy, I think, needs to be extended further than the formal doctor-patient relationship. Apparently, I'm told, he was in the green room with someone else waiting to go on a television show, and it was a sex therapist that he knew because she had appeared on his program. Her name was Laura Berman, nothing secret about it. It's been already discussed on Twitter and other social media. So they're in the room together. He asks everybody who's in that green room to leave, and he puts a question to her. He says, look, I'm having trouble in my marriage. My sex life is bad. Would sexual aid, sexual toys, is that something that helps? Is that something that my wife is likely to respond well to or negatively to? And she talks about it with him. But later, she talked about it with news people and said that she had had this discussion post the problems that Lauer was revealed to have had with other women. Well, she's not bound by the doctor-patient relationship. She wasn't in any formal relationship when they had that discussion in the green room. But when you tell everybody else to leave, when it's someone that you know, when it's clearly a sensitive subject like sex or drug use or something else that oftentimes gets stigmatized, I think it's fair for the person to assume that if they're talking to a doctor or a therapist, they're going to get privacy. It's true, Lauer didn't say don't discuss this with anybody, but the mere act of saying I want to talk alone or I want to ask you something privately, really, whether you're a therapist or for that matter, just a friend or a social acquaintance, I think people expect that you're going to keep their secrets. And as an experienced therapist, I think in this case that should have happened. So it is true, you're not going to jail, you're not losing your license if you're not in a doctor-patient relationship, if you spread information, sensitive information, personal information about others to third parties, or worse, talk about them on television. But it is true that you've got to exercise ethical sense. When people ask you to discuss something, a medical problem, a personal problem, you can certainly refuse and say you only want to do that in the office or only want to do it in a doctor-patient relationship. But once you go so far as to say, okay, let's talk, then I think you ought to extend the ethical protections of privacy and confidentiality that would be expected in any doctor-patient relationship. I'm Art Caplan at the Division of Medical Ethics at NYU. Thanks for watching.